Before the war, Etra had a normal life. Privacy, routine, a home, a place where everyday things happened without a second thought. Today, she lives in a tent. Like many displaced families in Gaza, Etra shares limited space, limited resources, and little privacy. But displacement is not the only challenge she faces. After an injury during the war, Etra underwent emergency surgery that saved her life. In normal circumstances, living with a stoma can be managed with access to clean water, privacy, and proper care. In a displacement camp, those basic needs are difficult to come by. Every day becomes more complicated. Simple routines require planning. Small tasks become exhausting. And even moments spent with family are overshadowed by the constant responsibility of managing a condition she could never fully stop thinking about. Surviving the injury was only the beginning. Living with its consequences became a burden she carried every day. For months, Etra adapted to a reality she never chose. Then, through PAMA's Reducing Surgical Waitlist project, she learned there was another option. At Al-Sahaba Hospital, Etra was assessed and scheduled for surgery by one of the teams helping address Gaza's growing backlog of non-trauma surgical cases. For the first time since her injury, there was a path forward, a chance not simply to survive, but to reclaim part of the life she had lost. This is not the story of an operation. It's the story of what the operation made possible. The surgery was successful. A few days later, Etra returned to the same tent, the same camp, the same difficult circumstances. But she returned differently. The condition that had shaped so much of her daily life no longer dictated every decision. The constant worry began to fade. The burden she had carried for so long became lighter. Sometimes transformation doesn't look dramatic. Sometimes it looks like relief, like comfort, like being able to focus on your family instead of your condition. Etra's story is one among many. Through PAMA's Reducing Surgical Waitlist project, 185 patients have received free surgeries, including hernia repairs, gallbladder procedures, thyroid surgeries, stoma reversals, and cancer-related operations. Performed by board-certified surgeons, these procedures are helping reduce a growing surgical backlog while restoring health, independence, and dignity to patients across Gaza. For people living with untreated conditions, it affects every part of daily life: their ability to work, to care for their families, to live without pain, discomfort, and uncertainty. For Etra, surgery did not end the war. It did not rebuild her home, but it gave her something she'd been missing for a long time: the freedom to think about something other than her condition, the freedom to be a mother again. For every patient who receives care, many more are still waiting for relief, for treatment, and the chance to carry a little less. Help close the surgical wait list. Help give someone one less thing to carry.